Welcome to Trend Hacker Future Stories. In the heart of Europe, our unfolds that could redefine healthcare accessibility. Imagine a future where everyone, regardless of where they live or what language they speak, can access top-notch medical advice at the click of a button. We are at the European Parliament anticipating a debate on the European Telemedicine Network, TN. This initiative aims to bridge the gap in healthcare services exacerbated by a glaring shortage of healthcare professionals of millions of healthcare workers. In some countries, we have 2.4 doctors for every 1,000 people. That is not a gap. It's a gulf, Hans Kluge, 2023. In the reality of our story, telemedicine is now gaining traction thanks to its successful integration into corporate wellness programs and the establishment of telemedicine booths across urban and rural landscapes. The transformative power of AI in this narrative cannot be overstated. Live-AI translation technologies are breaking down language barriers, paving the way for seamless communication throughout Europe's varied linguistic region. Moreover, is pivotal in streamlining patient care and directing individuals to the right medical assistance promptly and effectively. Finally, a unified budget allocated based on usage promises equitable resource distribution, ensuring no country is left behind in this digital healthcare evolution. Let's ponder in this future story how the European Parliament approves or denies the ETN. Brussels, 2034. 2034. The European Parliament hums with anticipation, poised for a pivotal moment to reshape healthcare across the continent. A unified challenge cuts across Europe, from sun-drenched Spanish vineyards to icy Scandinavian fjords. A critical shortage of healthcare workers threatens the health of nations. The charged atmosphere is calmed by Chairperson Marie Leclerc's steady presence. Her voice, imbued with resolve and optimism, rings out, unveiling a future vision. She introduces a vision of the future, one where no European, regardless of where they live, will be denied access to healthcare. The conversation is led by Dr. Alejandro Garc A., who brings a personal narrative from his upbringing in a secluded Spanish village. Dr. Garc recounts his youth, marked by a scarcity of medical care as rare as rain in a drought-stricken land. His experiences paint a vivid portrayal of hardships common across Europe. He sees hope within the proposed European Telemedicine Network, ETN. His accounts of untreated ailments and silent endurance argue the solutions as a remedy to these healthcare deserts, providing a lifeline to Europe's most remote areas. Inspired tales from rural Ireland fill the chamber as Liam O'Sullivan presents the latest data on telemedicine. The increasing adoption of corporates to offer access to telemedicine booths for their employees as extra benefits, the feedback from remote areas, and the latest telemedicine booth, with holographic displays and the increasing integration of live translation reducing misunderstanding and misdiagnosis. O'Sullivan's narrative celebrates technology's power and a vision of a Europe where equitable healthcare transcends distance and isolation. The discussion shifts with Elena Kowalski's input, who injects a cautionary note with her AI healthcare experiences. Together with Sophia Bergman, they emphasize maintaining medicine's human element, advocating for a balanced AI and telemedicine integration. A clear message emerges: technology should enhance, not replace, the empathy and understanding that are the cornerstones of healthcare. The debate peaks with Marie Leclerc's suggestion for an updated ETN framework. She envisions a symbiosis of technology and human care, where ethical guidelines and oversight ensure AI and telemedicine advancements augment rather than replace professional medical roles. Her proposal aims for a healthcare revolution that honors technology's potential and the irreplaceable value of human interaction. The ensuing vote, silent yet impactful, reflects Europe's dedication to this vision. The vote rings out a resounding endorsement for the ETN. This marks a leap towards an accessible, ethical, and human-centered healthcare system. As the assembly disperses, a unified sense of purpose prevails. Acknowledging the road ahead will be demanding yet is rooted in a collective pledge to a brighter future for all Europeans. A fresh chapter in Europe's healthcare saga begins. The continent, celebrated for its diverse cultures and histories, is on the verge of a technological renaissance, aiming to redefine the essence of medical care. The European Parliament's deliberations and decisions have established a foundation for a system that aims to reconcile innovation with empathy and technology with humanity. The day following the vote, the European Parliament's halls buzz with a tangible sense of accomplishment and anticipation. The dialogue among parliamentarians and aides extends beyond the ETN framework's successful passage to the tangible steps toward its realization. There's a spirit of constructive debate as various voices deliberate on the operational intricacies of integrating the European telemedicine network with existing healthcare frameworks. Central to these discussions is Dr. Isabella Rossi, an Italian digital health innovator who introduces a pioneering idea, forming a European Health AI Ethics Committee. Rossi, with her extensive understanding of AI's benefits and risks in healthcare, advocates for a forward-thinking approach. Her proposal aims to create a committee that oversees AI applications in healthcare and spurs innovation by guiding developers on ethical AI design principles. This body, she argues, would ensure AI and telemedicine's application across Europe adheres to the ethical guidelines underscored in the ETN resolution. Meanwhile, at the grassroots level, the impacts of the decisions are most palpable in the following years. In a small Polish town, Marta Nowak, a nurse, shares her enthusiasm for the ETN with her patients. Marta's clinic has long grappled with a lack of specialized medical professionals. Through personal stories, Marta demonstrates how telemedicine revolutionizes patient care by facilitating access to specialists without necessitating lengthy travels. Her anecdotes vividly bring to life the human dimension of the ET in illustrating how technology can extend compassionate care's reach to Europe's furthest corners. The story also unfolds in Berlin and Barcelona's vibrant tech hubs, where startups and tech giants are rallying to align their innovations with the newly established ETN standards. A highlight is a collaborative endeavor to adapt the AI-assisted diagnostic tool designed to enhance, not replace, human doctors. This project epitomizes the ETN's ethos, demonstrating how technology and human expertise can merge to improve diagnostic precision and patient care. This initiative, among others, exemplifies the innovative drive propelling Europe's tech community to impact the healthcare revolution positively. As the narrative expands to the global arena, Europe's innovative steps towards melding technology with ethics in healthcare garner international acclaim. The European Union's strategy is celebrated as a paradigm for integrating innovation with humanity on a global scale. Delegates from across the globe express eagerness to learn from Europe's experiences, contemplating how similar principles might be adapted within their healthcare framework. This global discourse highlights Europe's influential role in defining healthcare's future within its borders and as a beacon of ethical and inclusive innovation worldwide. This evolving tale of Europe's healthcare transformation, enriched with fresh perspectives and initiatives, captures the dynamism and intricacy of integrating technology into medicine. It's a tribute to the continent's dedication to a future where healthcare is accessible, ethical, and centered on human values. As Europe embarks on this path, the story of its bold advance in healthcare continues to unfold, fueled by innovation, guided by ethical standards, and inspired by a vision of universal access and empathy.